Ever wondered why some people have trouble seeing objects at a distance, while others struggle with reading a book up close? That's because of vision defects, common conditions that can affect anyone, anywhere. These defects, often due to the way our eyes bend or refract light, come in three main types: myopia, also known as nearsightedness, hypermetropia, or farsightedness, and presbyopia, a condition common in older age. Let us delve deeper into these common vision defects and understand what they are, what causes them, and how they can be corrected. First, let's talk about myopia, also known as short-sightedness or nearsightedness. This is a vision defect that hinders the ability to see distant objects clearly while nearby objects remain perfectly in focus. So if you can read a book but struggle to read a road sign, you might be dealing with myopia. Now you might wonder, what causes myopia? It can be due to the high converging power of the eye lens, which means the lens has a shorter focal length, bending light more than necessary. Or it could be because the eyeball itself is too long, causing light to focus before it reaches the retina. But fret not, myopia is correctable. The solution lies in using suitable spherical lenses, specifically concave lenses, which help to diverge light rays and correct the focal point on the retina. So, if distant objects seem blurry to you, you might be experiencing myopia. Now, let's move on to hypermetropia, also known as long-sightedness or far-sightedness. This is a vision defect that affects your ability to see nearby objects clearly, while your vision for distant objects remains unimpaired. It's as if your eyes are designed for gazing at the stars, but when it comes to reading a book, things get a little blurry. So, what causes hypermetropia? Well, two main factors could be at play. First, it could be due to the low converging power of your eye lens. Think of it as having a lens with a large focal length, not quite suited for focusing on close-up objects. Second, it could be because your eyeball is shorter than average, which interferes with how light is refracted onto your retina. But here's the good news: hypermetropia can be corrected using suitable spherical lenses. These lenses help adjust the focus, making those nearby objects clear again. If you're having trouble reading this text on your screen, you could be dealing with hypermetropia. Finally, we have presbyopia, a vision defect that often comes with age. This condition affects one's ability to see nearby objects clearly. It's like the universe's version of a cruel joke. As we get older, our eyes lose their power of accommodation. This is often due to the weakening of what we call the ciliary muscles and the inflexibility of the eye lens. It's like your eyes are refusing to keep up with the pace of your life. Remember, understanding is the first step to correction. If you're experiencing any of these symptoms, it could be time to visit your eye doctor.